Assalamu alaikum. Welcome back to Hilaal Live. Thanks for watching us on channel 347 on DSTV. It's that time of the year where, we often get a change in season and we always wonder, how does it affect various parts of our body? More importantly, our skin as well. And so I thought, let's invite a doctor who specializes in dermatology, based right here in Pinelands in Cape Town, Dr. Samina Parkar. Assalamu alaikum. Parkar, my apologies.
That's correct.
Are you well?
Wa alaikum salam wa rahmatullahi wa barakatuh. I'm well, thank you. How are you?
I'm very well. Thanks for taking the time to come and talk to us. Ever so now and then, we often get people sending in WhatsApps, hey, please, can you cover this topic? Please, can you cover that topic? And this was one of the topics that people said, please, can you ask a dermatologist to please come into studio and share some knowledge? So for those of our viewers that would like to know more about yourself, give us a bit of background. Finished school 2 years ago, practice. Tell us a bit more.
Sure. So I did my undergraduate degree at the University of Stellenbosch. And thereafter, I did my 2 years of internship at a trauma hospital called Geer F. Jooste.
Okay.
That used to be in Manenberg, that then moved to Mitchells Plain District Hospital. So I was there for 2 years. And then I did 1 year of community service at Kailicha District Hospital.
Okay. All right.
Thereafter, I did a bit of medical officer time in Kimberley for about 2.5 years in the field of dermatology, which was my passion from 4th year of medical school.
Okay, nice.
Yeah, so I was fortunate to find, the stepping stones that led me to where I am today, alhamdulillah. And then after that, I got a post at Tygerberg Hospital, and that's where I completed my postgraduate training in the field of dermatology. And alhamdulillah, last year I qualified as a dermatologist, and I'm now practicing at the Dermatology and Hair Institute alongside Dr. Altaf Parker in Pinelands.
Brilliant. And I would imagine that through that experience, you must have, encountered so many people with various issues, challenges, especially when it comes to dermatology as well. What is a typical consultation like? I mean, obviously there are different forms, and we'll get through that, as the interview progresses. But when it comes to someone walks into your practice and says, I'd like to make an appointment, I'd like to come and see Dr. Parkar, what are the steps that you take them through?
Sure. So fortunately, by the time they come to the practice, they've already got an appointment.
Okay.
So most of them have a doctor that's referring them, usually a general practitioner or another specialist that sends them to us, and they just contact our reception directly. Alternatively, patients phone in by themselves. So social media is a
big tool.
Big tool.
And referrals as well, I would imagine.
For sure. And then by the time they reach us, I mean, it differs from dermatologist to dermatologist, but we usually have a 20-minute consult where we, of course, break the ice first, establish a rapport, exactly, and then we take a thorough history, do a physical exam, and that includes a skin exam, a full body one if it's relevant.
Okay.
And then, I mean, you have 20 minutes to win the patient's trust, and in that 20 minutes, you also have to make a good enough impact, because for those 20 minutes, they're your patient. But as soon as they leave your consulting rooms, they become everybody else's patient.
Of course. But I would imagine during that time as well, it can be an intrusive process, depending on what the treatment is.
Yeah.
And let's face it, with the onset of social media, there's become a very prevalent way of how people look at themselves in terms of how they wanted to be presented on social media.
Yeah.
Thank goodness for, what do you call those?
The
filters. I don't recognize some people sometimes when they use filters. And I'm like, okay, yeah. But I would imagine that has exacerbated how people want their appearance to look.
Of course.
Especially in the facial.
Even aesthetics and cosmetics has increased exponentially. And I think it's because people are becoming more conscious, more aware. It's also good in a way. I mean, especially where cancer is concerned. And I treat a lot of skin cancers. So it's very nice that patients are more, using more sun protection and have become more conscious of sun damage.
Look, the African sun can be harsh, and it, I would imagine, gets worse in winter. People don't realize that because the sun, wants to strike through a lot, stronger in winter. But the African sun is quite hot. The climate in Africa as well determines how our skin is treated as well.
Definitely.
One of the avenues that I'd like to explore is maybe the root of acne. You know, we all have kids, and some of our kids go through that process of, you know, the teenage years, but you also get adult acne as well.
Yes.
How does your industry define acne?
Okay, sure. So acne is actually called acne vulgaris. That's the full name of the skin disorder.
Okay.
And vulgaris in the Greek language just means common. So it's called common for a reason, because it is that common. And I would say 80 to 90% of people walking on planet Earth would have had acne at least once in their lifetime. Some people, of course, just have minimal skin involvement or very mild disease, whereas others have, you know, very disfiguring inflammatory disease that can end up with severe scarring afterwards. So that's acne vulgaris, and it's mainly a chronic inflammatory skin disorder. So by chronic, we know that it's there for a long time. It can be recurrent or relapsing, and it's an inflammatory skin disorder that affects your pilosebaceous unit. So pilosebaceous unit is the collective name for a hair shaft, a hair follicle, and that is attached to an oil gland. So we call that a pilosebaceous unit, and that's what it affects. And it's typically a disease of the adolescents and young adults, but as I said earlier, it can persist, and as you also rightly said, it can persist later on in life and even present later on in adulthood.
So the treatment, I would imagine, is then assessed on the person's age. I would imagine male or female as well.
Definitely makes a difference.
Makes a big difference. And would certain factors like work and home life, would that influence the amount or the type of acne that you treated for? Not acne, you know, that's what we get on a Sunday here in Cape Town. But would that influence that?
Certainly. So I think where work life and personal life is concerned, stress is a very well-known trigger for acne flares. So that's where that's relevant. And then the treatment mainly comprises of, obviously, we try and not paint every patient with the same brush. It depends on, like you said, the gender of the patient, the age, and also the severity of the acne. So you get different grades of acne, and what we try and do is, of course, that helps us decide the extent of disease and the severity. So, for example, we have 4 grades, and grade 1 is when you have just the comedoes, and comedoes are whiteheads and blackheads. So the whiteheads are the ones that don't have any follicular opening, they're blind-ended or closed. And then the blackheads are the ones where you can see the follicular opening. And they're black because that's keratin and melanin that has become oxidized in the skin. And then that's grade 1, that's a mild form. And then you get grade 2 where you have papules, so those are the red bumps in the skin. And then grade 3 is obviously comedoes, papules, and pustules. So as soon as you have a bit of pus, then we call it a grade 3. And then obviously grade 4 being the severest form where you have nodules and cysts, and those are those deep-seated, painful, you know, indurated lesions that you find. So depending on the grade, that's how we treat acne. But the backbone of acne treatment, irrespective of which grade it is a retinoid. So whether it's a topical form or an oral form, we have to have a retinoid on board when we're treating acne. And if it's a mild acne, then we always try and get away with just applying something. So we often use antibacterial face washes, so benzoyl peroxide face wash, and then a topical retinoid. So you get just retin A, cream or gel, depending on, you know, what type of skin the patient has. Obviously, if it's a patient that has oily skin, then we tend to go more for the gel. And if it's inflammatory acne, more for the gel. And then the other treatment is a combination of benzoyl peroxide and adapalene, which is a second generation topical retinoid combined, and that we use to apply it to the skin. If that doesn't work, then obviously we have to add on, you know, medication that you can drink, and that would be your tetracyclines. So those are antibiotics, and we usually give a 3-month course in combination with something that you apply at night, like your topical retinoid. And if that option has been exhausted, you've tried all the other avenues. In a female patient, another one, that I forgot to mention is, of course, the oral contraceptive pill, especially if it's a hormonal acne. And then the last option is your Accutane, which is oral isotretinoin. And I mean, there are lots of generic names for it, but that's sort of we have a lot of faith in that medication.
Okay, gotcha. We need to go for an ad break.
Sure.
It's very fascinating, and I'm sure our viewers are going to look forward to the latter part of the interview. Thank you once again for coming into studio and sharing such valuable information. We're going to take an ad break and then also break for Maghrib Salah from Makkah. Do join us just after 6, where Dr. Samina Parkar tells us a bit more, educates us a bit more about the industry called dermatology. You are still watching Hilaal Live. Assalamu alaikum. Welcome back to Hilaal Live. Thanks for staying with us. And my colleague Faraz Patel and the team takes over just after 6:15. But we're still in Cape Town for now and covering the topic of the dermatology industry. Sometimes it's a bit of a tongue twister, some of these words. And Dr. Samina Parkar is in studio to tell us a bit more as well. Doc, thanks so much for coming in and being so informative as well. Before the break, we chatted about the different types of acne and, some of the causes of acne as well. But maybe we can reiterate some of the causes of acne vulgaris. You said that's the official name, right?
Yes, that's the most common one.
So maybe we can rehash some of that info for our viewers.
Okay, sure. So the causes, there's no one particular cause. It's a very complex, multifactorial disease. Mm-hmm. And there are 4 key features that cause acne. And the first one is, if I can explain using my hands.
Of course you can.
I need you to use your imagination. So if you imagine the pilosebaceous unit as, you have a little skin opening or pore, and then you have a hair shaft that's exiting from the opening.
Right.
And then you have your hair follicle, okay? And every hair follicle is attached to a sebaceous gland or an oil gland.
Okay.
Okay. So the first thing that happens is you get follicular hyperkeratinization. So I'll simplify for you just now.
Okay. Thank goodness I didn't pronounce that one.
So, in normal skin, we have what we call skin cells, and those are called keratinocytes.
Okay.
And what they do is, so they basically being shed on a daily basis. And that turnover, so for a keratinocyte to go from the basal layer of the skin to the most superficial layer of the skin, it takes about 28 days, and then it gets shed. Okay, so the same thing is happening within the follicle. Okay, so you're having keratinization, but in acne you have hyperkeratinization. Okay, so that means that you overshedding those skin cells.
Gotcha.
So that's the first thing. Now you can imagine if your little tunnel or your opening is stuffed with lots of skin cells, plus these skin cells are sticking together. They're cohesive. And the reason for that is you have androgenic stimulation of your sebaceous gland. So what that means is, so we all have hormones in our blood, and the culprit ones in acne vulgaris are testosterone and dihydroxytestosterone. And what these hormones do is they stimulate
both male and female.
Yes, both male and female have them. And in females, just prior to your period, your estrogen and your progesterone levels drop. Thus, there's a relatively higher level of testosterone physiologically. So what happens is these hormones then stimulate the oil glands to enlarge and to produce more oil or sebum. So you have your little opening. You already have all of these, this hyperkeratinization that's happening inside that little tunnel or opening. Plus you have this massive oil gland secreting oil into there.
Wow.
So you can imagine it's going to form a little blockage. Those skin cells are going to stick together. They're not going to move anywhere. And it's going to form a little plug. And that is what we call a comedo. Okay, and that's a blackhead or a whitehead. That's the start of the acne lesion. Okay, and because that swelling, that oil that's being secreted has nowhere else to go. The skin cells are not being extruded or shed off. You get swelling that's forming. So the tunnel starts to widen.
Right.
So you get swelling, and then that's called your inflammatory papules, or the red bumps that we see in the skin. Eventually, it ruptures because it's got nowhere else to go. It's very swollen, and then that's when you have pus forming in that area. And then, of course, as the swelling gets much worse, and then you get nodules and cysts forming. Those are the deep-seated ones. So that's the first aspect, is the follicular hyperkeratinization. The second thing is the fact that you have your hormones stimulating your sebaceous glands to increase in size and produce more sebum. The third problem is there is a bacteria that's part of our commensal flora, and it's called Cutibacterium acne. nothing cute about it because it causes all sorts of problems.
Correct, yeah. It stops us from going out of the house,
Exactly.
basically. Yeah.
So it finds this ideal environment to thrive because it loves the free fatty acids that are present in the sebum. It finds it as a nutritional source.
Okay.
So that then triggers your innate and your adaptive immune response, causing more inflammation. And obviously, then the fourth thing is inflammation. So those are the 4 key causes or features that we get in acne.
Wow. Okay, that's a lot to take in. And I would imagine that obviously you would take your patient, your clients.
Definitely. I use images in the practice. Yeah, definitely. That helps.
One of the things I've always wondered is, does things like the food we consume or the lifestyle we lead, does that influence our quality of acne that we get?
Sure. So that's an excellent question. It's something that I get confronted with almost every day in practice. Where lifestyle is concerned, of course, you want to have a healthy lifestyle as best as possible. Of course, smoking is definitely, I mean, not just acne vulgaris, many skin conditions. Smoking is a well-known documented trigger. And this is not me. This is research that's showing that. And then, of course, stress, as I said, the necessary evil in our lives.
So true.
That's definitely another trigger for a flare-up. And then as far as diet is concerned, fortunately, chocolates, though they are thought to aggravate acne, they do not aggravate acne. So lots of good news for the listeners. And for myself, I love chocolates.
Exactly.
So no, it doesn't play a role.
Okay.
And the 2 things that do or that have been proven to influence acne are firstly a high glycemic load diet. So glycemic load is a nutritional concept that basically tells you the glycemic effect of carbohydrates. So how easily carbohydrates raise your blood glucose level.
Okay.
So obviously,
food examples?
So foods
like
that are high in carbs. So pizzas,
Okay.
I'm just saying.
Right.
One of them, you know, fatty foods, fast foods, deep fried things. So these all, of course, raise your glycemic index. Okay. And that definitely has a strong association with worsening of acne. So you want to follow a diet that's got a lower glycemic index. And then the second thing that's been implicated is skimmed milk.
Oh.
Yeah.
Wow.
Yeah. So
That's interesting.
Not full fat,
Yeah.
dairy
Skimmed.
products, skimmed.
Wow. That's very fascinating because we've been told that's healthier.
Yes.
It's good for you.
Yes.
You know, lower certain things, you know, levels.
Not in acne.
Wow.
Yeah.
Very interesting. Okay, so also earlier you went through some of the treatments of how you would treat some of the patients that come to you. But before we go there, I want to, you know, pregnant women unfortunately cannot take certain medication.
Of course.
Cannot always do certain things that the doctor would tell them to do.
Yes.
Is that a concern when clients come to you as well? Is there a special treatment of how you would diagnose or treat a pregnant lady?
Sure. So, of course, if it's a very mild form of acne, I try and just counsel and reassure them because the last thing we want to do is harm the baby in any way. If, of course, it is, you know, cosmetically disfiguring or psychologically distressing for the patient, then, of course, we have to do something about it.
Right.
And what we do is, of course, you know, doxycycline, which is an antibiotic that we use in our normal patients. It's definitely contraindicated.
Okay.
Roaccutane is a huge no in pregnancy because it causes retinoid embryopathy, so it can cause neural tube defects in the baby. So we do not allow patients to be obviously on Roaccutane even if they're trying to conceive, if they're pregnant or even breastfeeding for that matter. So the safe options in pregnancy would be things that you can apply. So it would be benzoyl peroxide, azelaic acid. We tell them to stay away from retinoids. And then in terms of oral treatment, things that they can drink, antibiotics, I said, are a big no, but there is one called erythromycin, and that is safe to use in pregnancy. And what I generally do is I try and counsel them as best as I can, and I tell them, you know, as soon as baby's out, come and see me again, and we'll get to the bottom of it. But I try and treat it as conservatively as possible because the last thing you want is to harm the unborn child.
Absolutely. Thank you so much for that. It's really appreciated. A couple of minutes left.
Sure.
And maybe give us some advice. And I mentioned earlier our seasons and our African climate can influence quite a bit of what our skin goes through.
Sure.
But maybe some general tips. I mean,
Sure.
let's take teenagers
Yes.
and adults.
Sure.
You know, how teenagers are plagued with acne,
Yes.
adults sometimes as well. Yeah. What's your best advice on skin treatment?
I would say the first thing is to try and not squeeze, scratch, or pick on the lesions, the pimples.
Yeah.
Because acne is not difficult to treat. I mean, any doctor can treat acne, but the scarring and the post-inflammatory hyperpigmentation that it leaves behind is quite difficult and costly to treat. So try as best as you can not to fidget with the lesions.
Easier said than done.
Of course. And then, of course, try and, get on top of it as early as possible.
Okay.
Because the scarring, as I said, is the hard part. And, of course, it leaves a lot of it's a huge psychological impact on the patient. It affects their self-esteem, the way they perceive themselves. So I would say get on top of it early. And then remember, it's not an infection. It's inflammation in the skin. So avoid over-cleansing the skin. Okay. And that's what I often hear patients saying, that they use exfoliator every single day, or, harsh cleansers. So just a gentle cleanser every day. Followed by a moisturizer. And even if you've got oily or greasy skin, your skin can still be dehydrated. So that's another misconception, that oily skin is, doesn't need a moisturizer. So that's not true. You have to moisturize every day. And then, of course, you want to avoid occlusive products. And by occlusive products, I mean, bio oil, tea tree oil, things that are greasy, that are going to cause more blockage of your pores. I mean, I've just explained the cause of acne, so you don't want to aggravate the blockage that's already there. So more water-based products. And then for adults, especially females, we love our tinted sunscreens or makeups. I would say also use water-based, non-comedogenic, hypoallergenic products.
Nice.
And then, of course, sunscreen is very important. I mean, I say this like a broken tape recorder every day
and some
to
people
all my
don't think
patients.
you could use it
Not
in
just
winter
for
as
cancer.
well.
Exactly. You have to. In fact, clouds are deceptive. So sun rays penetrate right through clouds.
Absolutely.
So you want to be wearing sunscreen every single day, because remember, you have UVA and UVB rays, and UVA is the one that causes skin aging and pigmentation, and B is the one that causes cancer. So you want a broad spectrum sunscreen, SPF 50+.
Okay. Gotcha.
Sure.
Dr. Samina Parkar, it's been an absolute pleasure having you in studio.
Thank
I hope that you're going to join us next week again, where we cover an interesting topic surrounding dermatology and how we take care of our skin. We all need it. We all need to be more vigilant, especially with the increase of skin cancer around the world, not just in Africa. And thank you so much, and all the very best with the practice as well.
Thank you so much. Thank you for having me.
My pleasure. Have a great evening. Assalamu alaikum.
Wa alaikum salam.
That's Dr. Samina Parkar joining us in studio. Inshallah, she'll be back next week as we chat with her about another interesting topic. That's all we have for you from the Cape Town studio. So Hel Barnes and myself, Luqman Shadrack. We hand over to the Johannesburg team to take you through until about 7:30. Faraz Patel and the team. Thanks so much for watching Hilaal Live. Have a great evening. Assalamu alaikum.